Hypertrophic cardiomyopathy doesn't always cause symptoms, but in a small group of people, there is an increased risk of sudden death. If there are certain regions of the heart that are particularly thick, that could prevent blood flow from leaving the heart, and that tends to exaggerate some of the symptoms that we typically associate with hypertrophic cardiomyopathy. The most common symptoms of hypertrophic cardiomyopathy tend to be shortness of breath, getting winded, not able to walk as far as you should, chest pain or a sensation of chest pressure, especially when you're exerting yourself, palpitations, a feeling that your heart is racing. Certain patients with hypertrophic cardiomyopathy can develop abnormal heart rhythms that can cause a sensation of the heart racing, and that can also predispose or increase the risk of a stroke. It can also potentially cause episodes of passing out, or worst case scenario, even sudden death. Certain patients also can develop a stiff heart and over time can develop a weak heart that can lead to fluid buildup and worsening shortness of breath. Knowing the diagnosis is important because certain people need a defibrillator to help prevent that risk. An early diagnosis of hypertrophic cardiomyopathy is absolutely critical. The main reason for that is so we can know if you're one of these people who do need a defibrillator just to help prevent that risk of sudden death. We're also learning more and more about certain medications that might be helpful to prevent the progression of hypertrophic cardiomyopathy. And it's also important because knowing the diagnosis might help in terms of getting your family members screened who are also at risk of having the same condition.